Interface Tour.
Today's webinar is entitled Finding Health and Wellness at Your Library, a Consumer Health Toolkit for Library Staff. Your presenter is Kelly Ham. Kelly is the Consumer Health Coordinator for the National Libraries of Medicine Pacific Southwest region. Kelly helps libraries and community organizations provide quality health information services to the public. Kelly develops presentations and training materials with a focus on health literacy, new technologies for delivery of health information, and services to special populations. I'm now happy to introduce Kelly Ham.
Hi, everybody, and welcome. I'm glad you were able to come today. I'm delighted to announce a new resource from the California State Library and the National Network of Libraries of Medicine Pacific Southwest region, otherwise known as NNLM-PSR. That's easier to say. This project has been a long time in the making. It's been over a year, and the project began several years ago with a simple question. What could the California State Library do to help local public libraries improve their capacity to provide reliable health information for their users? Now, this question was the basis of a survey that was deployed by the State Library in 2007. And it was a large-scale survey that went out to 3 different groups: library staff, library users, and also healthcare professionals. And the reason that it was sent to all 3 was that there would be a much better chance of really understanding the problem about how people accessed information in the libraries, what issues the libraries faced in providing information in their unique communities, and all of the other associated problems and possible solutions to those problems. So that was the basis for this project. The findings from those survey questions resulted in a number of recommendations. And I have a summarized list here, but I'll go into a little more detail. Basically, not only the knowledge of core health materials, but really understanding the standards or how to evaluate core health materials. That was a key component. That also, with online health information, that's an additional component now. At one point in the past, it wasn't, but now online health information is maybe as important as print information. So another finding and recommendation was that there was a need to improve not only the services, but also the information infrastructure. And the toolkit goes into a little bit of detail on that. How do we improve the consumer health services and also those information services? It's very tied together. A key component was designing, providing, or facilitating training of library staff. And we know through InfoPeople that happens all the time, but not so much specific to consumer health. So that was an area where there is a need for more training. And then the final recommendation was to create an internet health portal. Now, typically when we think of this, we might think of a website, and that creates problems and issues of its own. So we will let you know how we decided to solve this problem. The project proposal came about from one of the visionaries in California. Many of you are aware of Suzanne Flint and some of the efforts that she's made. But she is with the California State Library, and she's really a true advocate for health and wellness, for all Californians with the help of libraries. She has done some work with, she is the one who spearheaded the work, I should say, with Transforming Life After 50. It's one of the things that she's noted for, and other initiatives with the State Library too around health and wellness. So Suzanne's vision really became the successful proposal, which resulted in an LSTA grant, and with the support from the National Library of Medicine and the contract that funds my office and the work that I do. So the Consumer Health Toolkit is what we came up with as a way to address all of these problems. It is designed as a professional development tool geared to public library staff. And while I say that, it will also be useful for other library staff, anyone in a consumer health library, in a hospital setting, people who do provide consumer health information services to the public. It has a more far-reaching target audience than just the public library, although we are assuming that the primary user of this toolkit will be the public library and library staff. It is based on a set of core competencies, and so all of the resources in the toolkit will support the core competencies that are laid out in the toolkit. The rest of the toolkit, after the core competencies, really covers all aspects of consumer health services. So we have, anything from programming to creating marketing materials to identifying core reference for special populations and those kinds of things. It's really an all-encompassing type of a resource. It's also designed to be a dynamic tool that will grow over time, and the philosophy behind the building of this toolkit is that it has a very definite health, prevention, and wellness focus. It's for all library staff. When we were originally thinking of the project, we knew that we would be including things such as programming and marketing, which typically are more the librarian's area. But then we realized that every library staff has a role in marketing the service or helping with programming. They may, participate in all kinds of ways. And so we decided very early on that this resource would be specific to library staff of all types. So there may be parts of the toolkit that won't be as interesting to some staff members because they don't have any responsibilities in a certain area, but all of the material is meant to be accessible by everybody. And it's also a good idea to become familiar with the other parts of library services, even if it's not in your particular area. So one of the things that we thought was important was to have learning objectives. So each of the sections has objectives and what we hope to achieve by providing the materials in that section. Another key concept is that thinking of libraries as a place where people in the community can look to as a healthy place. So we're trying to have libraries embrace the idea of being healthy places, because that concept by itself can improve the health of the entire community. And we feel this because if a library is known for having good health programs that are well attended, maybe there's an after-school program for kids where they do the Dance Revolution or any of the things that really get people moving or interested in healthy activities, then pretty soon the community starts to pay attention to that. And so if librarians and library staff kind of take on this idea of personal wellness and also wellness as a place, then we feel that is a very good model and example for entire communities. And that is something that we're hoping that this toolkit will bring awareness of and that libraries can adopt. And finally, one of the most important parts is that health professionals, typically have not had much experience with what libraries can provide. They may be familiar with their hospital library, or maybe when they were going to medical school, they were familiar with the academic health science library, but they're typically not as aware of what the public library can do for members of the public, and this became evident in the survey that was done. So it's clear to us that any kind of relationship or partnerships with healthcare professionals and health organizations within the community can be a very good way to tie in the services that you provide. And the toolkit has a section for healthcare professionals, and also, more work will be done in the future to try to help create partnerships and provide some examples and models of how these things can work. Well, a little more on that later when we talk about the healthcare professionals section. So I do see one question in the chat box. I'll go ahead and address that now. The toolkit is actually live right now, and the version that is available is what I'm calling a near final draft. We were hoping it would be completed by today. The project is still ongoing, and it's going to wrap up within the next week or so. And our plan is that the final version will be published on the State Library website by the end of next week. I'm hoping it will be sooner, but you know, that's our target date for the final version. And later on in the website, in the webinar, you will be given the website address where it's located. But it is a live working document right now, and it will become the final working document, you know, here shortly. And we'll talk more about how our intentions and our plans to update it over time. So a little bit more about the document. I mentioned a little while ago that we considered a website, but the State Library actually had, you know, they are unable to, with the current budget and all of the constraints with that kind of thing right now, it was impossible to do a website. And also, websites are chronically out of date. So as soon as you publish something, then there's a lot of work that has to go into, you know, maintaining it. And so without having the budget to hire somebody to actually do that, we discounted the idea of having a website. But a good alternative to that would be something that could live on the web, that could also be interactive and act like a website. So we came up with the idea to do an interactive PDF document. So the PDF format means that it can be printed out like an actual reference book. If it's used on the computer or online, then you can click on links and they take you right to the website. It becomes a much more useful document. And so that's what we decided to do. We hired a design firm to do the actual design work and put everything together. And it has turned out to be, you know, a very nice looking document. By the time we get all of the final appendix pages in and so forth, it will be somewhere around 94 pages. It's almost 100 pages, so quite a bit of content there. It is currently available on the California State Library website at the URL that you see. And like I say, this particular document is as a PDF form. You can access it directly on the web, or you can save it to your hard drive and use it that way. It is about 7 megabytes, so it's quite a large document. I recommend saving it to your local hard drive and accessing it that way. Okay, I'm reading a question in the question and answer. I have a question. Interested in knowing about shift of people using more online health info and less print info, and that changes where the library would place emphasis. And that's a great question, because we're seeing not only online health info, but we're seeing new ways in which people are using information on their smartphones and in different ways than we ever thought they would. In fact, there's an entire trend right now, people who have never used the web for health information, and there are some specific population groups that just for one reason or another have never really become internet users, either based on cost or, you know, the learning curve it takes to learn how to use a computer if you've never been exposed to it. But the interesting thing that's happening is that more and more people are carrying around cell phones now that have web access. And so there's an entire population that has skipped using computers altogether, and now they're accessing information on their mobile phone or their mobile device. So that's another new trend. I think that the question really is that, you know, how do you do your collection development if more people are using online materials? I don't think that there's ever going to be, you know, a lack of need for those print reference materials, but the key is knowing really what the core reference materials are, what you need in your circulating collection, and also then having a very solid knowledge on the very best online resources that are appropriate for your patrons. There is an entire section in the toolkit that talks about these issues, and we have defined a list of core reference materials, print, core reference, and and there's an issue with doing core reference. I'll talk about that when we get to that section. But this is a great question, and I think it is unique to every individual library because of the populations that you serve. So it's really, doing that needs assessment, seeing where the changes are occurring, and then seeing how you can train your staff to shift to the online resources if that's appropriate for your community. So a little bit about the development process. This project started about a year ago, and we knew right away that it was going to be a large project and we would need lots and lots of advice and help doing it. So we contacted a number of librarians and health professionals, people in the health information field, to form an advisory committee. And we had quite a large committee. We communicated by electronic means mostly, and also teleconferences. We had an in-person meeting that was very well attended. I think there were 25 people in attendance, and we got some great ideas and told of our plans for the toolkit, got some feedback. And then we started off on the project. And most of the people on the committee are public librarians and consumer health librarians, but we do have some folks who are literacy specialists and patient educators and also health professionals. So the input from all of these different groups was vital, and we really got some great information as far as how to put together the design and also what the content should be. So then to take it to the actual gathering of the content, we hired librarians and subject specialists to gather, recommend content, and also do editing and revising of the content. And I want to give a special mention to one group of librarians. The Plane Tree librarians in San Jose were just essential to this project as far as gathering the health resources. So we had experts in the field that were helping us gather the content. Now I'd like to just walk you through the sections of the toolkit. There are 6 major sections, and the first one I feel is probably the most important section in the sense that this provides the foundation for the entire toolkit. It's a professional development tool, and in order to, we thought if we provide all these resources, that's great, but we really need to base it on what an individual person would need to know to provide quality consumer health services. So in looking at all of the core competencies lists that are out there right now, we have lists from RUSA, the Reference and User Services Association from the American Library Association. There is one from the Special Library Association. The Medical Library Association has a section called CAFIS. Some of you may be familiar with CAFIS, and that is the Consumer and Patient Health Information section. So we looked at the core competencies lists of all of these different groups, and we didn't find anything that really struck us as being what we wanted. So all of the people on the advisory group provided input in this area, and we came up with our own list of 8 competencies that are very specific to consumer health. And some of these are what you would expect, providing good health reference services and being able to communicate well and those kinds of things. But there are a few others that are new and maybe more up to date because of the changes in technology and so forth. So we feel that this is really a good list as a starting point, and library staff can use this list as a way to kind of identify their own areas of expertise. As they read through the list, they can ask themselves, where am I in this particular area? Do I, really feel comfortable in this area, or is it something that I could improve a little bit? So you can use the list as a self-assessment, and then taking it from there, each of those competencies has sections within the toolkit that will support the gaining of skills and knowledge in that particular area. So like we said before, this is going to be an evolving document, and we're hoping at some point in the future that we can include an actual self-assessment tool. That we didn't have the capability to do it within this part of the project, but we're hoping that that will happen in the future. The second section is the health resources section, and I have a little bit to say about this section. This is quite a large portion of the toolkit. It is really a listing of resources that can be used for all kinds of topics. And you'll notice the very first bullet point is A to Z versus a topical organization. When we first did this, the section was just in an A to Z listing. And that's actually the way it is right now on the version that's posted. But we decided that it would be much better if it were organized topically. So in other words, we had a section on Alzheimer's and asthma and caregiving and complementary and alternative medicine. Now, in the A to Z list, that's fine, but really we had topics that fit better together. We have now a healthy living section and a couple of other sections, treatments and that kind of thing. So you'll notice when you see the final version that it is organized in a much easier to use. I think it's more user-friendly the way it will be organized in the final version. These are all with the philosophy and the focus on prevention and wellness. These resources are not treatment and diagnosis and treatment of disease resources. These are more specific to prevention of disease, wellness, healthy living, coping with an existing disease, because that's a very important part of staying well is if you already have a condition, how do you live well with that particular condition? And also support. So it's really not meant to duplicate some of the other high quality authoritative sources like Medline Plus. Medline Plus is such a great resource that it didn't make sense for us to try to duplicate something like that. We really wanted to have this be a unique resource. And so the resources that you will find here, sometimes it points to an actual website. Everything is annotated, so you'll be able to read an annotation before you click on the link, just to get an idea what the site is about and why we felt it was important. Some of the resources are specific pages, and that way, so it runs the gamut of either being an entire website or just a specific resource. They're also meant to be kind of a representative of the best. So any of the resources here can be used as an example of the type of resource that would be appropriate for a patron in your library. So there's no way we could do a comprehensive listing. As we were gathering resources, I kept having to cut things out. The people who were gathering the information were finding such great resources, but it was ending up to be so unwieldy that we really needed to cut back and just have a representative slice, so to speak. And so I think you'll be pleased when you see the quality of the resources that are there. We have included a lot of PDF files, and the reason we did this is that from my own experience in working at a public reference desk, I know that when people want health information, it's often very difficult to print out a web page. You get the ads, you get odd spacing, and it ends up being 10 pages long, when really all you need is the information itself. So we have included PDF links whenever possible, and we've marked them so that you can see those are the ones that are easier to print or email to somebody. I do see one message that came in. Someone was asking if the toolkit is something that we can link to from our library homepage, and you can absolutely do this. This was funded by LSTA money and money from the National Library of Medicine. So this is a resource that can be reproduced freely. It can be linked from a website. You can use it however it makes sense within your library. you can also, save it and link to it directly if that's easier for you. Okay, the next section is also a very large section, the Consumer Health Information Services. This is the section where you'll find all of the things you need to know to provide good consumer health services. So many of the things in this section will be more interesting to library managers or, adult services librarians. But as I said before, all library staff will have some reason to go to this section. There is a very good section on providing health reference and links to, to guidelines and, just lots of good resources that will help any library staff understand any of these things. An important part is the Understanding Health Literacy section. There are great resources there that just help the library staff person know how to communicate well with the patron who is, having a difficult health question, and lots of different resources that you can use, today, starting right away. One of the most important parts of the toolkit is in this section. It's the core reference and series recommendations. And the problem with creating a core reference list is that it goes out of date immediately. Another problem is that we always think that with health information, it goes out of date quickly. But some books, some printed references, don't have a new edition. And maybe it's the type of information that doesn't necessarily go out of date. A good example would be if you have a circulating title on treatments for breast cancer, let's say, that's going to go out of date much quicker than something that talks about coping with the death of a loved one. So if you have those, this is part of the art of collection development and weeding or deselection of this particular area. It's really more of an art than a science. And if there is a great title that is maybe, published in 2000, it still may be a valid thing for your collection, either for circulation or for reference. So we have included some titles in this recommended list that are older, maybe more than a couple of years old, but the reason they're in there is for those reasons that I just mentioned. So the core reference and series titles that I have in this section are print titles, and then the health resources section will have the online titles. So if you're looking for online resources, you'll want to go to the section 2. Now these aren't numbered 1, 2, 3 in the toolkit. They're just named by their title. But the health resources section is where you'll find all of the online resources. And the very first part of that section is where you'll find what I call the key online health resources like medlineplus.gov, healthfinder.gov, the NIHseniorhealth.gov, kidshealth.org. All of those sites are in the very first section of the health resources part of the toolkit. And getting back to the core reference and the series recommendations, many libraries will find certain series that they have either as reference titles or as circulating titles. And we've collected a number of them, and we feel that we can recommend any of these. So if there are certain ones that you really like, then those titles are good. Wherever we can, we've identified the website where they can be ordered. Some of them are a little tricky, where you have to go in to the site that we've linked and then do your search. But we've tried to make it clear in the annotation if it's kind of tricky to find that particular series within, because the publishers publish so many different titles. Anyone who's done collection development, knows that sometimes it's not easy to find the actual series, but we've done our best. Moving on to some of the other parts you'll find in this section are the partnerships. Creating partnerships is key in any kind of an endeavor these days. With budget shrinking and not having as many staff on board, if you can leverage your resources by creating partnerships in the community. That is definitely the way to, get the most bang for your buck. And with community health organizations, often they are looking for a partner, and they may not be thinking of the public library. They may have someone who can come to speak to a group. If you know that within your community, going back to bullet number 1, the community needs assessments, if you know that there is a high incidence of diabetes and obesity in your community, then that's a perfect way to get someone to come in and talk to patrons about, creating healthy meals, having a cooking demonstration, having someone explain how to read a nutrition label, or any number of things. There's some great ideas that are listed in the toolkit. And that takes us right into the next section, which is programming and marketing. So if you can leverage those partnerships and do great programming, then market your services, you're going to bring more people into the library and really provide a great service for your community. All of this, we believe, is a way to make your entire community a healthier place. And that's really the underlying reason for doing this toolkit, in addition to helping libraries just develop their services and have everybody be as good as they can be in providing these services to your users. The next section, the Technology and Health 2.0 section, covers 2 types of content. And it became very clear to me as I was doing this project that we really needed a section that covered some new methods of delivery and some new types of information. Now, I personally got interested in podcasts quite a while ago. As soon as NPR was available for download as a podcast, I started subscribing, and the first one that I subscribed to was NPR Health, because I wanted to hear what I didn't have access to it on a daily basis, and so that way I had it in my pocket. Whenever I was going for a walk or something, I could listen to these podcasts. And I started exploring, and I found there were so many podcasts that were available, and it sort of piqued my interest. Well, now it's old hat. Everyone is producing a podcast, and now it is to the point where you have to put on your evaluation hat every time you look at some of these things. But podcasting is just one way of a use of a technology for delivery of health information. There are other kinds of things that are happening. We have mobile applications for smartphones, all kinds of things, including jog or walking trackers. You can download something to your phone which will tie into the GPS unit on your phone, and then give you a Google map of the route and the distance and how long it took you to do that distance right on your phone. And then you can share it with, on Facebook, or send it by email, or all kinds of different things. So that's another method of delivery. Mobile websites. For instance, Medline Plus now has a mobile site. So if you type in m.medlineplus.gov onto your browser on your phone, it will bring up an optimized site of information. It's optimized for a small screen. So it's very easy to use, and gives some of the most important information from Medline Plus. So, if you're standing in line at the pharmacist, you can quickly look up, the side effects of a medication, as an example. And that's another type of delivery of health information that is very new. Some of the other areas in this section are now it's very common for people to not only access user-generated information on social sites, but share their own information. And this is a complicated issue for librarians, because if you have a library user who is wanting to know about a social site, it's difficult for a librarian to really recommend something that's not authoritative. But one of the things I like to think about is, who would know better about an issue, a health issue in particular, than somebody who has that health issue and has already gone through all of the things that they've had to deal with, either trying new medications or treatments, or finding a healthcare provider or whatever the case may be. So there are some sites that are more authoritative or that have better controls for privacy and this sort of thing. So this section really goes into the detail about how to help your patrons find those good sites and what to share with them so that they can make good decisions about the sites that they're accessing. So this is the trend, and we have to understand that people are using information this way, and whether we like it or not, we need to learn about it so that we can give good guidance to our patrons. So the next section is workplace wellness. And again, following the theme of prevention and wellness for the entire toolkit, we included this section as a way to help libraries either create wellness programs in their own workplace or to act as information providers for businesses and organizations in the communities, because many times, the small business needs information about how to implement or plan, some sort of a workplace wellness initiative. And this way, if the library is aware of the resources that exist, they'll be able to better serve the people in the community. Again, the idea of libraries as a healthy place, being the model. And so this can be on a personal level or on an organization-wide level. And we encourage everybody, even if, any kind of effort you can make for your own personal health, small or large, is worth it. And, so we're real advocates for that and can only get better from here. The final section is the resources for healthcare professionals. And this section, many of you might wonder why this section is in here, because after all, it is a professional development toolkit for librarians and library staff. But this section was included for a couple of reasons. One, we understand the importance of having the partnerships with the health professionals. They really are key in helping us provide good health information, and they need to understand what libraries can do for patients and for members of the public. The survey that was done identified some pretty interesting facts, and one was that most health professionals didn't understand that library staff have training opportunities to learn how to provide good health information. They understand how to evaluate health information and can help the patron understand that too. They maybe aren't aware of all of the resources, the really high quality resources that libraries can point to, for the patron or the patient or the caregiver, whatever that person is who needs the health information and the reason that they need it. So this section really is intended to bring, awareness of the need for partnerships with health professionals, health organizations, and libraries. And a key component, so this section is intended to be used by the health professional. There is a section on health literacy and recognizing when a patient might not understand what the clinician is telling them, and following that, guidelines for improving communication. So these are great resources that can be used by the health provider. Also, we like to point out that any of the resources in Section 2 and Section 3, those core reference materials, the print materials, can also be recommended to patients, and the clinician can trust that if they're in this toolkit, they can trust in the quality, and they'd be able to recommend them to their patients. Because typically the internet has kind of a bad connotation, or the clinician may think that anything from the internet is suspect. And so if they find it in this toolkit, they know they can trust it. So just moving on to how to use the toolkit. When you get in there, you'll notice that there are some features. We've made an attempt to have this be as user-friendly as possible. Because it is a PDF document, we're able to make it interactive. So the table of contents are actually links, and you can click on the part of the table of contents that you want. It will take you directly to that section, which is nice when it's a 100-page document. We've also included the use of icons, and the next slide will show you what those icons look like. But the icons will very quickly tell you what type of content that particular resource is. Each of the annotations will have a website link. And whenever there's a website link, it's hyperlinked to the actual page or site. So you can just click on that and it will take you to that site. We are creating an acronyms list because as we put together this toolkit, you can imagine there are dozens of organization names, and sometimes they appear many times throughout the toolkit. So the way that we have decided to do this is whenever there is an organization with an acronym, we spell out the organization name first, in the first time it's used in a section, and in parentheses we put the acronym. And then in subsequent annotations, we just use the acronym. But there will be an entire list of acronyms in the organizations at the back of the toolkit. It's not there in this current version. It's going to be added in the final version next week. We've also included little helpful tips boxes, and they look like the one you see on your screen. So this particular one is what I had said earlier, but while the PDF file can be accessed on the web, it's more efficient to save the file locally. This is because it's a 7-megabyte file, and every time, if you just start accessing it on the web, every time you click on a link and then go back to it and click again, it wants to reload the PDF. So it's best if you can possibly save it or even print it out. The one disadvantage to printing it out is that the URLs are often quite long and would be sort of awful to try to type in, but they're there if you need them, and you'd be able to go to the main website and then search for that content. This is what the icons look like. We have, anytime there's a print book, we have the book icon. I mentioned that we have lots of PDF files throughout. If you have a patron that needs this either printed or sent to them by email, some of them are quite long, so you'd want to check before you print it. But you could always save the PDF file and then send it to them by email or show them the link and have them do that there in the library. There are video files, audio files. Now, these would be streaming video or audio. If it's an actual CD or DVD, then it has the different icon. We've also included, anytime there is an online tutorial or an e-learning resource, we have the little apple. And actually, I forgot to mention this. These are listed in the core competencies section. The training section is in the core competencies section, which is the first section. So the final 3 icons are for special types of content rather than format. All of the ones that are colored above are for format, and the 3 below are content. So we have easy to read or easy to understand materials. And we also have anything that is either in Spanish completely, or if the link, when you load the link, there's Spanish language content available on the page. And if it's a multilingual resource, so not just Spanish, but maybe Asian languages or other kinds of languages. So multi is multilingual or multiple language. And hopefully that's clear. We just needed to condense the words on the icon so that it would be easy to see and not take up too much space. So I have another couple of questions that have come in. One of them is, are there particular social networking sites for patrons who have health problems that others can become members of? Those are listed in the section. And yes, I do have several that are listed in the section. We have some that are specific to say, cancer, breast cancer, or other kinds of disorders or diseases. Some of them are more broad. There's one called Patients Like Me, and it's a site where they have several different types of conditions that are represented, and then you go in and register. Now, typically, I do want to say that most of the resources in the toolkit do not require registration, and none of them require, private information. But in the case of a social networking site, you have to register in order, typically you have to provide a username and a password and something so that you don't, spam the site or whatever. So some of them do require minimal registration, and we've made an attempt to include only the ones that have good privacy policies. So those we have some there. Where will the link be located after the webinar? The link for the page will be on the InfoPeople page. So, and if you have additional questions, you can always send me an email directly. One additional question came in. The question was if we've looked at Google Docs or other ways to publish the PDF document so it's easily viewable. That's actually a great idea, and I will look into that question. I have not done it yet, but if there's a way that it can be easily viewable without that large download every time, that would be a great thing. So in a few minutes, I'm going to give you the Twitter feed that I've set up for this, and I will be posting updates to the toolkit on a Twitter feed. So that will be my way of communicating with folks who are interested. And in fact, it's right here on this next slide. So future plans, we have some training planned with InfoPeople. There will be a 4-week online class in January. It will basically cover all of the areas that are identified in the core competencies. So any of you who are interested in having a follow-on training that would tie in with these competencies, check back with InfoPeople. It's scheduled starting in January and ending in early February. I will also be making comments on the Twitter feed about new classes whenever they're available that are consumer health related. And when we do the updates to the toolkit, we will include those new classes because right now it's kind of sparse. There is an email that I've set up where anyone who wants to send feedback, suggestions, any corrections, if there's a dead URL, they can send an email to healthtoolkit@gmail.com. And we are hoping to do document updates every 6 months. So as we've said before, this is a living document, and we intend to do regular updates, and we'll plan to do that every 6 months. So now Twitter is kind of new to me. I've had a Twitter account for quite a while, but I haven't posted. I've used it more as a way to look at information coming in. But now I'm going to jump in with both feet. I did my first post today, which was a brief announcement about this webinar. And it is Health Toolkit. So for those of you who are interested in following this feed, anytime there's a new resource that I think would be appropriate for the toolkit, I'm going to post it on this Twitter feed. So I'm anxious to hear your suggestions and feedback, and please feel free to use that the healthtoolkit@gmail.com email to send your comments. So how are we going to evaluate this? We're going to be doing an initial evaluation to test the survey and the actual survey tool and the initial impressions that people have of the toolkit. We're going to be doing a final evaluation in early 2011. That will either be in January or February. And that large-scale evaluation will be done after libraries have really had a chance to use the toolkit in the field and to find out if it was useful as a professional development tool, if the health resources section is good, if they like the PDF format, all of those kinds of things. We're going to ask for suggestions for improvement, but most importantly, the California State Library is interested in finding out what else they can do to help libraries as they try to provide quality consumer health services in their own communities. So it's going to be a big evaluation, and we hope all of you are able to participate in that. Now, we would like to request volunteers for the initial evaluation, which is going to happen here in the next couple of weeks. And we actually are going to be giving you a polling box in just a minute, but because the toolkit is a work in progress, we want to continue to develop it and so forth. And we're asking for your help with evaluating the survey tool and also the toolkit. So Chuck, are you able to put up that polling box? There we go. So I'm going to explain a little bit about what this questionnaire, what you can expect. But if you're interested and willing to be part of the initial survey, put in your email address in the little gray box where it says type your answer here. And we'll leave this up for the next 5 minutes or so that you have a chance to do that. But here's the way it's going to work. The survey takes about 10 minutes to complete. And if you volunteer, you'll receive an email letter later today from Suzanne Flint from the State Library, and she'll provide a link to a questionnaire. You probably won't want to complete the questionnaire right away. You'll need some time to look over the toolkit. And we'll be collecting feedback through the end of September, so you don't really need to, to fill out the survey right away. You have a couple of weeks to look at the toolkit and then do the survey. And the survey only will take you about 10 minutes. You'll get a couple of reminder messages from our evaluation expert. Her name is Cindy Olney, and she's the evaluation consultant working with us on this project. So as far as the survey itself goes, you might find that a couple of questions are hard to answer because they assume that you've been working with the toolkit for quite a while. This is the survey we're going to be using in January or February, but what we really need is help to see if the survey has good questions in it. So you'll be helping us with the survey and also with your initial impressions of the toolkit. So we would really love to have your comments and your feedback. So if any of you are willing to provide us with your feedback, please type your email address in the polling box, and we really appreciate that. So we'll go ahead and leave that up for a couple of minutes. And if any of you have any questions about this, feel free to send me, a question in the Q&A box or anything. Okay. So given all of that, are there any questions about the toolkit, anything that I can answer for you? I do see one question about will a print version of the toolkit be available? And unfortunately, we were hoping we would be able to do that, but because it's a PDF document available on the web, it is available and can be printed out, but again, it's almost 100 pages. So it may be that if a particular section is of more interest to you and your particular situation, then you could print just the section. But the State Library won't be able to provide print versions. So we're hoping that I'm certain that there will be something for everyone in this toolkit. We have a question about how often the toolkit will be updated, and we are going to be publishing an updated version about every 6 months. If we have the opportunity, we'll publish more often, but at the very latest, we're hoping that new resources will be incorporated about every 6 months. And I know that some of the resources will go out of date before that. URLs will break. We're hoping that we can keep it updated on a more often. But watching the Twitter feed is a way to find out about new resources that are coming out. In the last month, I would say that the National Library of Medicine has posted 5 or 6 different things that would be appropriate for the toolkit. It just is happening so often that something new is coming out, a new mobile site, for instance. AIDS Info, which is one of the best AIDS information sites from the government, just came out with a mobile version. And as it turns out, I'm going to be able to include that in the toolkit because we're still doing the final touches on it. But in another week, I won't have the opportunity to do that. So we will be using the Twitter feed as a way to put out those announcements and let everybody know. Then you can always go back and do a search just for that Twitter feed and see anything that's been posted. So it'll be a nice collection of all of the resources that need to be added. And I have another question about how do we recommend resources for the toolkit. You can use the Gmail address that was in the presentation, healthtoolkit@gmail.com. So I'll put that in the chat box. This is where you can send suggestions, and you can send any corrections you find. If you find a URL that's not working, one of the web address links is not working, or you have a suggestion for a different way to word an annotation, or we've really missed something, that's the email to use. Let's see. I do believe we'll be sending out a notification every time the toolkit is updated. On if a major correction is done or a major update, we will send out a message, probably to the CALEX list. And I don't know if that will come from us or if it will come from the state library, but it will definitely come out when the toolkit is updated. The current version does not have a published date in it, or a version number because it's version number 1. The forward has the date that the forward was created, which was August 2010, but we'll put in a version date from now on. Now, the patrons, there was a question about whether or not this is appropriate for patrons, and each library can decide that. The one thing I would say, if there is interest, I could make just the health resources section a separate document that could be loaded onto public computers. It wouldn't be available from the web, but I could create just a section for the health resources. That's the section that would be of interest to patrons, rather than the entire thing, because a patron won't be interested in core competencies or, the resources for health professionals, for instance. But if there's interest in that, please send an email and let me know. It's a great question. Okay, we've reached 1 o'clock. Is there any final call for questions? I'm going to go ahead and go to the last slide. If you do have any questions, you can reach me at my individual email address, which is kkham@library.ucla.edu, and I'll put that in the chat box. And then the other email for feedback or suggestions, healthtoolkit@gmail.com. The Twitter feed is healthtoolkit. And then the actual document itself is at the URL that was listed below. And we'll put that up, the actual URL, on the InfoPeople website.